Yes, good evening, and how you day? Welcome to another session of Ask the Doctors. Today, na the 3rd of September. Happy new month, and how your side? So today's program, na question and answer session. We won't take some questions and respond, give you the answer. So if you know, so you get any questions for us today, just do well and ask us your question. Now, the program now every Sunday, 8 p.m. West African time. My name now Frederick Unubohai. How you day? Happy New Month. Where you dey watch me from? Yes, I can see say some people don't join us. Yes. Good evening, welcome. Chinwendu is here. Chinwendu Catering. How far now? How your side? More people they ask so many questions and God. Now me and Dr. Israel say make we answer questions today. So if you get questions for us, feel free to ask us your ask us. Watching from where? Watching from Worry. Okay. Is how far? Is how your side? How you did? Okay, good. I see you. Yes, I see you. Welcome. Okay. So if you get a question for me, feel free to ask me your question. If they watch me on YouTube, if they watch me on Facebook, welcome. I can see people there here. Dr. Israel, how far now? How you there? Hello, Dr. Israel. Your network, your network. This guy, make I send a message. Man, send a message. In network, what's in the happen? Good evening. Watching from Germany. Watching from Germany. Okay, man, send a message. Okay, good evening. Those from YouTube. Yes, Juliet, how far? How you day? Dr. Israel, how your side? Watching from Owerri.
Good evening. Sorry, man. My phone actually connected to something else.
Watching from
Connected to
Ghana.
my Bluetooth before.
Okay. Ngozi from Germany. Yes. Fatima. Yes, watching from Ekpe. Promise from Italy. Nice one. Watching from Anambra. Okay, I get information. Before we continue, the Fruit Challenge Season 2 starts October 1st, 2023. The reason why they do them like this now make we give enough announcement. A lot of people tell me, say, Doctor, the last one we una do, I know if you join una, and una don't finish before I hear. So now we they give 1 month awareness, make people join us. Fruit Challenge Season 2, October 1st to the last day of October. You go chop fruits, with your normal food every day for 1 month with your normal food. You go snap them, you go record them. When I make my daily post, you go put them for the comment section. So you get. So we they start the Fruit Challenge under hashtag Good Life Na Sense, hashtag Fruit Challenge. So if you get any questions for us, please drop your questions in the comment section. But remember, we know they prescribe medicine, we know they give treatment for here. Okay. Please, can you explain spleen enlargement? Dr. Israel, they say make we explain spleen enlargement.
Spleen enlargement and when the spleen enlarge big past the normal size. Spleen are one of the organ where the body where they help us they fight infection. They call it one of the lymphoid tissue. So you see they help us they fight a lot of infection for the body. And so most of the time when blood down at one place when see the help purify blood. So when blood pass through the spleen go remove some of the waste products where they the body. Now, in some cases, the spleen fit come become enlarged, big. And one of the time when the spleen go fit big na when the spleen itself don dey get infection, when the spleen itself don dey sick, so the spleen fit come big pass before. Also, for sickle cell patient wey be SS, most of their spleen dey big, and when they don dey get a lot of breakdown of blood, and their red blood cell don dey break well, and their spleen fit still come dey big. And so many other conditions still dey wey go fit make the spleen big. And so these are just some few ones when I just say make I mention. And make you also know say spleen enlargement means say the spleen when dey close to where the stomach dey, and there the spleen dey, na im big, and e fit cause pain as well for that area. Remember those there, all those people when they get design for their belle, tattoo for their belle, malaria sef fit still cause enlargement of the spleen. Now those people when they get design for their belle, get some part of Nigeria when be say that they cut their belle, na spleen na big, and when they think say something na one bad thing, they say na bad blood, they come cut the belle, come put tattoo like tattoo or design for the person belle. Now the spleen na enlarge for some cases, and malaria itself go fit cause that spleen to come big pass the normal.
Yes, thank you, Dr. Israel. If you just come, we dey take questions and answer today. So do us a favor, share this video. A lot of people don't know many things. A lot of people, they find questions and answers. So today, may we answer. So to support us, waiting we want may you do. Now, just share and invite your friends. We know they give medicine. Oh, remember. Okay, we get a question here from Michael Chukuka. He said, please, sir, can scanty growth of staphylococcus infection affect a menstrual cycle of a woman? I missed my period for the month of July, and I ran a pregnancy test, and it came out negative. Make I allow Dr. Israel may respond.
So the next thing will come be, how old are you? How many years you did? And that one go still determine who do the test for you. Now you do the test by yourself. If whether you do, if now you do by yourself, whether you do well, now only God know. And what did they even use to do the test? That one another question where you need to ask yourself. Now when we talk about staphylococcus infection, staph now one of the many well, I call it bacteria now when they the world. And sometimes we look at like normal flora, because even they every part of our body. So sometimes most of those tests when people they go do say na staph. This is when you even come to say na scanty. It means the test when you do, maybe they not even take the sample well. If it be say the scanty when they even see a part of the body when the staph normally now they go culture for you. Now they test say scanty staph they. So I will not even want to call that one an infection self. And it not go for it to be scanty, it not go get anything to do with your menstrual cycle.
Yes, so
not go really get anything to do with your menstrual cycle. So you need to go see a gynecologist and make they do some other investigation for you, other tests for you. With that one, now they go to really know what to make you not see your menses in July. And you remember I said this one in September already. It means that you not see your menstruation for July, and you also not see her for August, or you don't see her already for August. If you don't see her already for August, I don't think you need to trouble yourself again.
Thank you, Dr. Israel. To add to that, I beg you, we don't know who go do pregnancy test for you. You get many things if you make woman no see her period. Plenty. One now just now pregnancy. So many other things. This is why Dr. Israel tell you say make you see your doctor, a gynecologist. May they help you, because scanty growth of staphylococcus no fit sees your period. I beg you, yes. If you just come help us, so share this video. You go to ask us questions, help us share, and invite your friends. Can fruit make you fat? Can fruit make you fat? So Israel, what will be the answer? Let's make it fast.
The answer na no. Fruit not go fit make you fat. Eh? I don't need to talk too much on that. The answer na no. Because if fruit go make you fat, most of the time people when they do dieting, dieting, when they want make sure say they're not fat, one of the things when they eat now fruit. So if the fruit go make them fat, they go not go tell them make they eat fruit. So fruit, most of the fruit contain fibers. So it not go make you fat.
It not go make you fat. And again, I just remind you for the fruit challenge season 2. Special program where I don't start online. This food challenge from the 1st of October to the 31st of October. I'm not promising you anything, but all I can tell you is that when you join the fruit challenge, now you yourself go see the benefits. I know if they tell you now, people we don't do, I'm going to tell you. Many of them they here now and they testify. So I'm going to encourage you to join us from the 1st of October to the last day. No be only fruit, oh, you go chop your normal food, but you go take fruits. You go snap them or you go record them. When I make the daily post, you go put them for the comment section there. Do you understand? But fruit no go make you fat. Okay, share. Let's go to the next one. The person says, doctor, what position, I don't want to mention the word, is best for easy conception? What position? Okay. Dr. Israel, please, you want to respond to this?
Okay. And no special position. No special position. So every position feel make you get belle. So every position feel make you get belle. The most important thing now, when he enter, he release. That's the most important thing. And what he put inside, he dey waka well. And if he dey waka well, now the right time he take put am. And so those are now the question when you need to ask yourself. So now all those one I go bring about pregnancy, not be position, and not be which position you want take. So it means that every position go feel make am happen. But those things when I you ask, there are so many other questions when I talk about I don't know as I will take conny the question. I make now all of those are conny. So okay. That one not get anything to do.
Man, talk something else. Okay, thank you, Dr. Israel. I know, say we get new followers, new people, they follow us every day, new followers. Please, I beg you in the name of God. We get many videos for this page, plenty. Some of the questions where they ask us, by the grace of God, we don't already answer them. The videos they. So when you day less busy, go through the page. I can guarantee you, if you get question on menstrual period or menstrual flow, whatever, we don't already address, and since you go gain the information, you did the page. Do you understand? And for the new followers, you did welcome. For here, most of the time now pidgin English we they speak. That one no mean say we no fit speak other, you understand? But you get why we they do them. So we they welcome the new followers. So may you understand, say for this page, plenty videos day where we don't do in the past. Try help us watch and share the videos. Okay, we have a question here. Please, what can cause hotness of the body mostly all the time?
Okay. If na woman they ask this question now, I think I for your tell I want to say that one I feel be the major cause. But as far not be woman, okay. For woman, if woman, if it be hormone feel cause all those many things for them. Okay. However, if person they get a body they hot well, I don't know which kind of hotness, but if your body they hot all the time, most of the time means say you get fever. Because when we say hotness of the body, now fever, now it be. So now the question will come be what they cause fever. So many things fit cause fever. Malaria fit cause fever. If they get the your body the hot every day, if it be typhoid, you need to do tests to even confirm that one first, because not be just to say your body hot. Now, another thing, if you say you get some other infection of the you figure out that infection when be say that they cause your body they hot. And if it be inflammation, if it say you some inflammatory process they happen around you or inside your body when they make your body they hot. So these are some of the things where it cause hotness of the body most of the time. And some people when they're hungry, their body physically hot. Hunger physically cause that one as
well. And then if this hotness of the body don't pass 1 month, don't enter 2 months, don't enter 3 months, you go need, may we find out, you know why? It gets some kind chronic condition. Some kind chronic things there. We know they make anybody fear, so we know they mention diagnosis. Some people feel they get small issues with their blood. Some feel they get problems with cancer. Some feel they get hotness of the body together with weight loss. Do you understand? Many things. Or maybe the kind of job where they do. So this is why if you know say your body done dey hot for a very long time, try speak with your doctor privately. No be say you go do typhoid test or you go test yourself then say na malaria. No, sometimes if it dey much more than malaria, and in brother we would always call typhoid. Please, sir, what causes water removing without being pregnant? I don't want to mention that word because of social media. You understand? So wetin make water they come out from the without you being pregnant? So Israel, want to respond?
Now, anything will make that thing happen now, hormone issue. So that person need to go hospital, go see a doctor, doctor where they specialize in women. Make them see her, make them for check her and see what you go to make her make the place they bring water when be say the person not get belly or he not get pikin. And so now some of the hormone for the body, get one of the hormone where they call is it prolactin. If it be say now don't many well for the body, now they cause that. So if it even be discharged, now they come out for there. So you just need to see your doctor when they treat women, and now then go feel can't give you correct answer and what you need to do because of that.
Make we talk something again as we go every time we talk we know they treat online here now to just teach. So in case maybe you join us now, you can't find, maybe we'll go tell you go buy this medicine, drink. We know fit to it is against our profession and we no one lose our license because with this social media. All we did here now to just educate you and we go advise you, speak with your doctor. Do you understand? Maybe we no go talk something. Our medical body will come call us, say who send you message. So that is why we know they prescribe medicine for this kind of thing. But yes, one stuff, feel be prolactin. Another one be say some people they feel they press the breast, and somebody feel they press and too much. If they make some things come out. Again, this question when you ask us, the video, this question, the video did the page. That video is about 10-15 minutes. So many options there. I spoke with Dr. Okwegwale, a consultant gynecologist, and he answered this question. He tell many things where you feel do. So please, madam, try watch the video. You go hear an expert's opinion on this too. Please, can you explain how to lower high blood pressure naturally and fast?
How to
lower high blood pressure naturally and fast?
Well, there's nothing like lower high blood pressure naturally that fast when they the back. Now I want to try to tell you, say there's nothing to everything about lowering of high blood pressure, you not get anything like fast. You need to take it continuously. It's a continuous process. So if you don't they put fast or there, it means say you want me we do magic, and there's no magic when it comes to that. Now, when they talk about high blood pressure, we know One thing I go let you know is that e get where e go reach, or not, these natural things no go really, no go dey enough. So at that time you need to take medications. You need to take medication. So why you dey take medication, e no mean say your problem don pass, be careful. No, not be wetin e mean. E mean say you really need to save your life. It is very important say you save your life. So one of the things wey you need to do when your BP, you notice say your BP dey high once a while, mostly for elderly people wey don dey hold small small. One, you need to reduce your salt intake. Your salt intake, you need to reduce am. Another thing I be say you need to reduce fatty diet. Anything wey contain too many fats, groundnut, oil, fry, and you when they fry, every food you eat, you fry them. You need to reduce them. If you dey drink alcohol, you need to reduce them. If you dey smoke, you need to reduce them. Then you can't need to dey do exercise as well. You need to dey do exercise as well. And for the elderly people, you know me say when you go dey run 100 kilometers or go dey carry weight. They are simple exercise, and when you go just dey do, and they go help you. And when you continue to do these things, you don't reduce your fatty diet, red meat, you don't reduce salt, you do spicy food, you don't reduce alcohol, you don't reduce smoking, and you do exercise. Yes, your BP go dey normal. However, if you don't do all these things and you still go check your BP and you see they very, very high, abeg go meet your doctor. May they tell you the next thing when you need to do.
Yes, thank you, Dr. Israel. If you just dey come today in a question and answer session, this program now every Sunday by 8 p.m. Nigerian time, West African time. Now we dey start 8 p.m. to 9 p.m. 1 hour every Sunday. So today's program, we dey take questions. But very important, please take note that we know they prescribe medicine. We know be your doctor. Our job now just to educate and clarify some things for you. Thank you for your understanding. Okay, we get a question here. Please, how many times should someone urinate in a day if you drink enough water?
You drink enough water, many water, you go urinate so many times. It all depends on the number of water when you take. It depends on the number of water when you take. And you go notice, say, for people where they urinate well, they know they sweat well. And if you drink a lot of water and you urinate well, it means say your kidney, they work well. That's what it means. So you don't need to dey fear once you dey urinate well. As far, and also, if the weather dey cold, it also means say you go urinate well. And you can't still go drink too many water. So no fear. As far you know, say as you dey urinate, you know they get pain. No blood for inside the urine. No discharge, they follow the urine. Then you don't need to dey fear. And you know say your sugar dey normal. You don't need to dey fear. And as far you know say now you dey drink a lot of water, it means say your kidney they work well. So no fear.
No fear. The only time where me go say make you fear. Now, if you can't urinate out of normal, no be how you dey urinate before. As you urinate finish, next thing you don't run again. You dey urinate anyhow. Then it go dey good make you see your doctor. We dey specify see your doctor so that make it no be say problem dey your body. We can't tell you say everything is okay. But as long as you dey drink enough water, your kidney go comot the one where you no need. But if you can't notice say you dey piss outside normal, maybe normally now 6 times you dey urinate in a day. Now you don't dey piss 10, 12, 15 times. Any small thing you dey go urinate, please have a conversation with your doctor. Is that okay? I saw my period on the month of August after the treatments. After which treatments? Chukuka, treatment given to you by who? I think now you ask us about a woman wey no see her period for July. We can go do pregnancy test.
I think so.
Yeah. So
yes.
What treatment given to you by who? What thing did they treat you for? Do you understand? And then if you don't see your period for August, I want to believe that this is September. Get hope. say the period go come this September, abi? As period come on August, this September, the period fit still come now. Now, when the period no come again, or your period come they disappear, they come, they disappear, they come. Many things the way your doctor go consider your age, go consider your body weight, the kind of work where they do, go consider other symptoms where you get. Do you understand? And many things. Is it normal to have menstrual flow twice a month? Tanisha, you want to respond to this?
Yes, for some people, yes, it is normal. It is normal. And it not depend on the length of the cycle. It depends on the length of the cycle. So most of the time, what normal cycle, cycle can be divided into short cycle, normal cycle, and long cycle. So some people, their normal cycle still fall within twice in a month. For those where they get short cycle, yes, for some people, it will be like that. And for short cycle, it will always be, most of the time, it will always be twice in a month. It will always be twice in a month. Normal cycle is between, I think it's 25 to 35 days.
21 to 35.
21.
Yeah, 28 days 21. Plus or minus 7.
Oh, yes. 21 to 35 days. 21 to 35. Yeah. Thank you. That's true. 21 to 35 days. So imagine somebody when they always they come out every cycle now every 21 days. It means that this person will likely see is it twice in a month, in some months, and twice in some months. Why sometimes you go see and once in that month. So it's not a bad thing. So now for you to know your cycle, and when you know your cycle, you go know how it go take be. Why even for some persons they even notice say they go see her once in 2 months, because when we say 35 days, it means say if I see her by 29th of last month, this full month I feel not even see her till the next month, early maybe 1st or 2nd of the next month. So now just the length of the cycle nine matter. Yeah.
Thank you. I beg. If you just come, help us now. Help us share. Invite your friends. Health information now free information, and they save life. Okay, this person says, what is cryptic pregnancy? Okay, make I try respond. Maybe Dr. Israel go add. You get why I won't respond. Cryptic pregnancy. I made a video about this. Cryptic pregnancy, it means a pregnancy where woman gets. This woman no even know, say she dey pregnant. It dey real, it dey happen. Very, very rare, but it dey happen. The word na cryptic pregnancy. You get a story of a Nigerian young lady. The lady get belle. She no know say she get belle. She thinks say she dey see her period. She can't go hospital. When she enter hospital, say belle dey pain am. Say na malaria and typhoid she gets. Doctor can't say no. Can't examine her. This lady be like you dey pregnant oh. This lady, it be like say you dey labor oh. She no believe. Next thing she born pikin. She no gree near the pikin. They had to call her parents. The parents come. They no believe say nah the girl born the pikin, because the girl said she no get belle. Yes, this is why they tell you it dey published. They don't document am. It dey online. You can read about it. However, some people for our country, some very wicked people, I don't want to misuse the word because of social media, they lie to some women, tell them, say, when you get belle, scan no go see am, nobody go see am, the pikin dey hidden for your leg, the belle you get na cryptic pregnancy. That is not cryptic pregnancy. That particular pregnancy where they tell the woman a lie. Wetin be cryptic pregnancy? Now a form of pregnancy where woman go get. This woman no go even know say she dey pregnant. However, as science, we can locate the pregnancy, we go find them. But some very wicked people in some parts of this country and other parts of the continent, they lie to some women. They give them certain chemicals to drink. Go come make the women swell up. Go make them their body change as if say they're pregnant. But true, belle no dey. They do am well. They collect money for their hand, 3 million, 5 million. Then when the woman won't go do scan, they go warn the woman, make she no go anywhere, go do scan. Say scan, no go see the pikin. Say no other place, we see them. Those people, they're supposed to lock them for jail. Now those people, they lie, tell you, say waiting the woman get now cryptic pregnancy. I had to do this because I don't really get encounter with some people where they chop their money because of this. Do you understand? I don't know if Dr. Israel get anything to add to this.
No, I know nothing. I think you said it.
Okay. What health condition can be causing burning sensations, pains in the back and stomach?
This person just carry all the symptoms where they worry and want tell us. May we all give a diagnosis. Unfortunately, many things fit cause all these things when you they talk. And if you say burning sensation, which part, where the burning sensation dey? Where pain in the back, which part of the back the pain dey? The pain in the back and the stomach, which part of the stomach? You see, it's a many questions there when we go even ask you before person fit arrive to any diagnosis. So that make I go advise you, make if na I go advise you, make you please go hospital, go and speak with your doctor, make them ask you all these many questions, do some investigation for you, and come out with a diagnosis for you so that they go fit treat you well and make you forget the best. I think that's what I will say on this.
Yeah, thank you, Dr. Israel. Sincerely, you know, if you just say, I get this problem, waiting the cause am. The doctor needs to know a lot of things, like waiting Dr. Israel ask you where the burning sensation dey, which part for the back, when this burning sensation starts, the burning sensation, is it tied to food, abi they occur any time of the day, how long, and other symptoms. So these are things the doctor go need. We're going to say, okay, most likely now this thing they cause am. But on social media like this, we no fit just tell you, say this is the cause of your problem. You understand? No be say we no one help you. Yes. What is the root cause of lymph node at one part of neck swollen?
Now, lymph node, not be disease. Lymph node in itself, that name, lymph node, not be disease. Now part of the part of the tissue where they help us fight infection. Now be lymph node. Part of the tissue where they help us fight infection. Now be lymph node. So they help us fight infection. And sometimes when they don't fight those infections, they go come swell. They go come swell. That's for some. Now, but if you don't get a very big swelling for neck, and if you don't get a very big swelling for neck, I beg you need to go see doctor. Because so many things fit cause that. TB fit cause am, cancer fit cause am, and some other things fit cause am. So you need to go see your doctor, make they examine that swelling, know why the lymph node for that neck swell well, and maybe sometimes even try to remove part of the lymph node, do some more tests, and find wetin dey happen to am. With that, they go fit give you good diagnosis. But you just need to know, say lymph node na part of the tissue wey dey our body, wey dey help us dey fight a lot of infection, and there dey many parts of the body, not be only neck there dey.
Wetin dey striking to me, this question wey you ask us, na how you take know say na lymph node dey swollen? Because a person wey no be medical practitioner no go talk say my lymph node is swollen. So how you take know say na lymph node? Generally, people go tell us, say, doctor, one part of my neck dey swollen. Unless maybe you don see doctor, they can't tell you, say, na your lymph node dey swollen. Now, if they don't tell you, say, na your lymph node dey swollen, they go tell you, say, okay, may we carry out tests on that lymph node to know wetin dey go on inside. And I beg, if they advise you to carry test, I beg, try do the test to know. But I won't believe, say, maybe you don't get medical intervention to fit know, say, na lymph node, 9 day swollen.
If be say never get to, if be say na Google, you don't check. Yes, I know what they talk. I get one of my friend when they quick check Google. When you don't check Google, Google don't tell her one thing. You quickly call wrong, come meet me, say, doctor, see, I'll just the first thing that they do, I go laugh. Then I ask her, who tell you? They say, I checked it on Google. I say, you see what Google will do you? Google will kill you before any other thing. No. Don't go get IBP because of Google. So please see your doctor and he go explain to you well.
Oh, she's a nurse. Oh, yeah, a nurse. I talk him.
Okay.
I talk him.
Okay, that's
I don't also get one patient. The patient come meet me one day. He's come say, doctor, I have throat cancer. I said, you get throat cancer, okay? How? I know they joke. He say, I have something in my throat. I cannot swallow. I feel something there. I said, okay. We can't talk. You can't tell me, say, Google lists so many tests. He don't go do the test. The test where he spend up to more than 100,000 naira for test. I can ask him, all these whole tests where you do, who send you? Now you don't go do test, you carry results come, and all of them were normal, nothing. After we can't talk, I say, come for God's sake, you're fine. Relax. Now Globus you get. Normal Globus way. After a while, the thing disappear. Yes, it's good to take your body seriously, but Google go put you for one chance. Sometimes the things waiting for Google, no be medical professionals the right time. Now person will just wake up and right time. I'll tell you another story. You know, so I did radio. So I want to do one health program for radio. I can't go do research. I can't see one write up for Google. I can't search the person will write time. Who be this person? Because the person wrote wrong information. And the thing was very catchy. I can't go search out the name of the person. Guess what? The person a journalist. No be doctor, no be nurse, no be anything, a journalist. And the way he writes this information, if you not dey careful, you go think say na medical professional and write am. This person a journalist. I did my research and I was like, no, it's not fair. So I beg us in the name of God, if you get problem like this, please have a conversation with your doctor. So we have a question here. He says, good evening. If doctor asks someone to do HSG, what does he mean? HSG, not HGS. HSG, what does it mean?
Okay. When your doctor say you go do HSG, it means say he want check your tube, whether they open, whether they open when if egg enter, whether you go fit pass, can't enter where belle, you fit can't get belle. That if you don't knock and you don't pour something enter, whether that one go fit go meet the egg for where the egg dey, come make the egg get come fertilize the egg, then come move and come where the womb where pikin go for grow. So now that be that test. Now they find, now they want check. So most of the time, people when they tell me do this test, now people when they look for pikin, when never get pikin, they don't check some other tests. They notice say maybe they notice say they okay, or they just give you the test, maybe you do all of them once. Because these days now so that they do it, they'll just give you all the tests. Sometimes maybe you do all of them once so that may they know, may they for quick tackle which part be the problem. So that one now be HSG.
What causes hormonal imbalance? And I believe, how do one go about the treatment of hormonal imbalance? Maybe that is your question. I want to believe. Yeah.
Dr. Fred, you can answer that person.
Okay. See, this question of hormonal imbalance is a very big one. Inside human being body, okay, so I have a video on hormonal imbalance, about 16 minutes. Hormone, they every part of your body. Hormone, then they make us grow as human beings. Hormones, then they make us act like man, act as woman. Hormone, then they make us sleep. Hormone, then they help us control blood sugar. Hormone, then they make woman see period. Hormone, then they help woman also make her get belly. Help woman release breast milk, keep your body temperature. So hormone, they control the body. Now, when the hormone dey normal level, we will not say the hormone dey okay. When the hormone too high or the hormone too low, either the hormone don't high past normal or the hormone don't low past normal, we go talk say the person don't get hormonal imbalance. And there are so many types of hormones in the body. Now, if you get hormonal imbalance, the next thing we'll go ask now, wetin be the type of hormone imbalance wey the person gets? Wetin be the symptoms wey the person gets? Okay, as we don't know the type and we don't know the symptoms, okay, is this something that we can use medicine to control? Abi na lifestyle? Do you understand? So when somebody gets hormonal imbalance, you need to know which hormone, number one, and then how to treat them. If na woman they ask this question, most times na the female hormone then the day imbalance most times. Sometimes if it be thyroid hormone too, if it still affect woman. So to know this thing when they happen to you, you go see your doctor. How do you treat it? You go only treat them when you know the kind of hormone where they imbalance. You sure you get, they'll can't tell you, okay, maybe na exercise you go do, maybe you go take medication, no, this and that. Sure you get. So hormonal imbalance, yes, they affect women well. However, it also affects men, they affect children, it can affect anybody. Now, very big topic. I hope this small information I tried touch me you understand. Dr. Israel, Abi?
Yes, you really said it all. I think that's all.
Doctor, my cycle always fall 28 days cycle or 30 days cycle. Is it normal? Yes, it's normal. It's normal. Like Dr. Israel talk, 28 days cycle, they normal. 30 days cycle, they normal. 32 days cycle, they normal. 25 day normal. For your own, 28, 30 days, they within the same period. Not be say because you get 28 days cycle, your cycle must be 28, 28, 28, 28 every month. Sometimes, if you enter 29, if you enter 30, if you enter 27, you understand? But it's still day normal. Dr. Israel Spitting says, please, does high blood pressure, I guess, medicine get after effects?
No drug for this life will not get side effects. And I make every drug get dose where you go take. And I make with you also they say make you they always go hospital for checkup. Mostly for people when they take chronic medication, high blood pressure medication, HIV medication, diabetic medication, every medication where we say the person they take over and every time, and what they call chronic medication. That is, they take them for a long time. Don't they take and they come. Those kind of people suppose that they go for checkup every time. Mostly when the doctor say may you come for checkup. And when they go for that checkup, sometimes the doctor will tell you may you do some investigation. Those tests when the doctor they say may you do now to test some of the organ when those drugs fit affect in future. So that made them know say yes, those organs still they very good. And the organs still they work very well. And which organs? Most of the one particular organs when be say all this many drugs fit affect quick, or when this many drugs they pass through, now the kidney, and also the liver. Yeah. So because the liver now they help us try and remove all the good parts where you go work for you. Then when the kidney, most of the drug, now the kidney now they remove them from our body, the waste product of those drugs from our body. So those two organs, you need to check them often, regularly, to they sure say yes, they still they can't pay as they do their work when they do concerning those drugs. So high blood pressure medication, yes, they fit get, but with the correct dose when you they take, they not go those side effects fit not happen to you. And not be everybody side effect of every drug they affect. So because they affect A, not mean say it go affect B. It just be like chloroquine. The side effect for chloroquine are that body inching when body the inch person. And some people they when be say if they take that chloroquine, it not they itch them. While some people if they take it go inch them. So the same thing with blood pressure medication.
Thank you, Dr. Israel. If you just did come, you did welcome. Help us share this video. They live, share. Make your friends, make them learn. Number two, if you just dey follow us, you do welcome. Remember, we know they treat for this page. We know they give medicine here. This place na market, it be like market. We know they share medicine online. We go always beg you, may you follow your doctor talk. Do you understand? Yes, our job here now to just educate you, advise you, say, if this thing they do like this is what you should go and do. Go and see your doctor, or relax, observe. But say we will share medicine on social media. We know they do them, I beg. For the new people where they follow us. And then finally, our fruit challenge, this is in 2, starts 1st of October. I just say make I let you know. Please, doctor, if a sugar level is 134, does it mean the person is diabetic?
It depends on the sugar level when you dey talk. Now fasting, now random, now the first time when they do wetin you eat before you go do the sugar level. All those are the things when you need to put into consideration before you go fit answer this question. So as of now, I don't think I not go want tell you say the person get diabetes, because you need to go see a doctor. Then you go know.
Yep. Fasting or random, we need to know. It's banana yellow color of urine normal. I don't know. I don't understand this question. Please, can you help us?
I think the person need to put the, now woman has this question. You know, say women they no color well. So, so I don't know which one be banana yellow color. Is it the color you are classifying as banana yellow, or what is that banana doing in it? If na just yellow color you dey talk, we go fit tell you something about it. But when you don't put banana join, it don't confuse us. So please just clarify the question. So, but if na just yellow color urine you dey talk, if it dey normal, you just need to go drink water. When you drink water, the urine go dey white again.
If I may add, normal urine is not 100% white.
That's not true.
So when you say banana yellow, this is you get. But normal urine color, they white. We they call them amber color, AMBER. So you can go to Google and type amber, AMBER. When Google open now for you, you go see amber. What amber mean for there? So you go know how it be. Okay, we get a few more minutes to go. Let's take the next question here. My son of 7 years always snore. Is that snore when sleeping? Please, what is the cause?
I believe it's snore. So, madam, your child is snore when sleeping. Another question when I'll ask, if they get catarrh during the day, even though you know they sleep, I breathing be. Those are not questions when you need to answer. So if you answer those questions, but not be me, you go answer the question too. You need to carry and go see doctor, mostly ENT. Doctor where they specialize in ear, nose, and throat. And then go look and check inside the throat, see if anything they enlarged when they make and they snore. So if those things they enlarged, they go know what they go do. They go tell you what they go do, and then they go treat them.
Please, doctor, what causes chlamydia for couples that are faithful to each other? I mean, don't cheat.
Chlamydia na infection. Na infection. So if one person get them before, whether before he dey faithful or not, he get them before I not treat am well, he go recome. And when he recome and he meet his second partner, the second partner go get am. If one can't treat himself, the other one not treat himself. When they remit, they get am. They go they get am reoccurring like that until two of them treat themselves very well, and they check themselves, say e not dey again, before the official say, okay, that chlamydia don go.
Okay. Doctor, please help me. Is dead sperm cells reversible? If yes, how can one go about it?
Dr. Fred, answer.
Ejiro, is your question hard though? Say doctors no be God, they don't get the final say. something feel look like dead sperm cells. Maybe if he come back to life, he move. So I can't tell you no and yes. But waiting I fit tell you be say, as long as you dey okay, you're going to find out first why the sperm cells they even die. Wetin dey make them die? Is it that the environment they too harsh, or something else dey wey dey destroy the sperm cells? If that thing dey and then try correct am, yes, hope dey say the sperm cells fit come back alive. You understand? So we no go come here tell you say no, sperm cell don die, so it cannot come back to life. God forbid bad thing, abeg. We no get the final say. So the best thing for you na to try see a urologist. A urologist na doctor wey dey manage men and that man area. They go carry out test again for you, confirm true if anyone dey alive or no one dey alive. If no one dey alive, they go come find out, okay, wetin dey make these sperm cells know they dey alive? Make we see whether we fit correct am. If dem correct am, maybe the things go come back to life. So see them, then we'll give you the final answer. But say we'll tell you yes or no. No vex. I know if it's no vex. What health condition can cause burning sensation in my back and my waist and stomach?
Dr. Fred, you fit answer that one if you want.
Okay. Burning sensation in your back and your waist and stomach. Back, waist, stomach. Hey God. If you talk stomach, abdomen, we will ask you which part. Maybe upper abdomen. Okay, maybe you dey get heartburn. Maybe. Many things dey wey dey cause heartburn. Sometimes heartburn also fit enter the person back. Sometimes. But if you can say they get stomach, they burn you, waist, they burn you. We need to be very careful. We don't want to rule out your symptom or use your symptom play online. If it be psychosomatic, if it be gastritis, upper abdomen, if it be gastroesophageal reflux disease, if it be peptic ulcer disease, if it be pancreatitis, if it be many things. So if you get heartburn or burning sensation for your back and your stomach, once again, your doctor, now you go need to follow talk. Make you find out where this thing they go on true, and if you need any tests. Wetin dey cause am, we here no be hospital, so we no fit tell you like that. If na food they cause you the burning sensation, food, avoid that food. If na something wey you dey drink they cause am, avoid them. If na severe form of stress, maybe you stress too much, it could give you heartburn. Avoid those things and see whether you go improve. But if you avoid all those things, yet it's still there, abeg, have a consultation with your doctor. Make it help you. Oh my God. Does ulcer have cure? Because I've been battling with it and no doctor have been able to give me a cure. So Israel, what do you have to say about this?
Okay, and I want to say yes. Also, I get cure. May I say yes for to some extent? Yes, to some extent, yes. Also, I get cure. But another thing, is I just try to be careful. I don't know as I want to talk this thing, sha. We need to. When you say doctors never fit give you cure, it means say there's so many things there where you need to do. Also not be something when they just cure overnight, and not be something when be saying you feel take drop for 3 days or 1 week and you go say also don't cure. No, now something when you go take drop for a very long time. Are you ready to do that? And now something when we say you still need to manage wetin you they take in. When go they cause ulcer and wound, and if that wound don't they heal, and you go put something for that place again, that injury when be done the heal go come back again. And now that one are the main problem why they make most ulcer not the quick heal. But yes, ulcer go fit heal, it go fit cure, but it go take a very long time, and you need to stop everything where you think or reduce everything where you think say they trigger that ulcer. That are the first step to treatment. And another treatment where they physically do for you now, surgery. and carry something pass inside your mouth, go look inside, then treat the place, and it dey expensive. So that one na still another way. Now make I tell you say ulcer get cure, but it just depend on how ready are you to get it.
And very importantly, abeg, e get one final diagnosis wey we dey take confirm for ulcer. If you know say you don dey battle ulcer a long time and they don give you so many medicine yet e no dey go, try ask your doctor make we do that test wey they go look inside, because if they look inside, maybe they fit find out exactly wetin dey cause your problem and wetin make am no dey go. Sometimes doctor go tell you say you get ulcer, yes, because of the symptoms and wetin dem think. But until we put that thing inside through the mouth or the nose, take look inside the belle, you cannot 100% say this patient get ulcer. So the final diagnosis, the gold standard, now when they put something through the nose or through the mouth, enter inside, go look inside to confirm true. So if you never do them and you know say you don't take almost all the medicine we then give you yet no work, all the advice we then give you, I beg, try discuss with your doctor, make them do that test for you. Maybe it will help you. We are almost out of time. My son, 11 months old, has swelling like boil beside his left, that's not beside the left scrotum. I think so. Please, doctor, advise me on what to do. Okay.
Abeg, carry your son go hospital. That's my advice. Finish. Carry your son go hospital, because they not dey use that area they play when children dey small. Please take your child to the hospital.
We are almost out of time. What causes change of menstrual cycle from 28 to 40 days? At times, not constant.
If you take some medication where you're not supposed to take, it go change them. Some people will take some medication, if you change them. If you dey on hormonal control piece, if you change them, then if your age don dey go reach people wey go so enter menopause, change fit still occur. Then hormonal imbalance, as Dr. Fred first talk, because I notice say that you fair ask a question on hormonal imbalance, fit still change them. So when you don dey notice all these things, abeg go see your doctor, so that if there's anything where they need to do for you, they go do am for you fast, and correct the problem.
Okay. We are almost out of time. Is 3 days menstrual flow normal? Yes, now. For some women.
Yes, it's normal.
And for some women, it's normal. It's normal. Especially if you don't see them like this, they come. Oh my God. Okay, we are almost out of time. We don't almost finish. Oh, let's see this question here. It says, doctor, if you start your menstruation on 1st, then when will you expect your ovulation? You will have to go to my YouTube and watch the video. Or Dr. Israel, please respond.
That one, you need to know your cycle first. Now, when you know your cycle, now you go know when you go ovulate.
Calculate. Yeah.
But the only thing when I'll tell you is that you need to know this, just know the signs of ovulation. So that when you don't read that and you feel no, say yes, so this might be my ovulation. So that's most important. And what will be the signs of ovulation? Some people they feel they get their body feel the hot past normal on that particular day. While some persons don't go get stomach pain for one side of the stomach. Sometimes if for 1 month if it be one side, the other time if it be the other side. Some people they are for their chest area, it feel they pain them. For now women they talk about it, they go understand when I tell their chest area, it feel they pain them. Yes, for some women it go they pain them. Why some women the discharge where they go they see go they watery, go they watery and go they drop. So within that period, you know say okay, yes, you don't get your.
Okay, we are out of time. We have to call it a day here. Once again, no vex. when we tell you, may you go see your doctor, we know why we dey talk am. Make we no go use your complaint play here. God forbid something can't happen. You go talk say, now these guys, now then use me play, they not advise me. Do you understand? So we are very careful on the kind of advice we they give. We dey very careful. Even your own medical colleagues, if you come online, can't drag you, tell you say you they do rubbish. So we dey very careful. Now I know say on social media, people they find who go they sell, who go they give them, go and buy, go and drink this, go and drink that. We know they do them. We dey careful. I beg. So we go beg you, wherever you are, discuss with your doctor. Our job here now just basically to teach you, educate you, and ensure that you take your health seriously. Once again, help us share this video, invite your friends. For the new people where they follow us, many videos there where we don't do for this page, plenty. For this page, for the past 3 years, we don't they do live session like this, and we get so many doctors too. We don't answer so many questions, so you can try to go through the page when you are less busy. You will see so many videos where go give you almost all the answers where you they find. I swear, almost all the answers. If na period, though, if na infertility, oh, if na fibroid, oh, if na malaria, or even typhoid, what? Trust me on that. I beg, take your time and go through the page. You will get enough information. Okay, Israel, any final words?
Okay, thank you so much. When una take the followers, I beg, I go need to beg una for this. When una take care of una self, when una take care of una health, una mental health, una physical health, una social life, when una take care of am. Recently, the way when young people take they die, not be beans again. And you notice say that things when we think say na old people you go key. Now young people they get them, and it's not interesting anymore. And as I talk to you today, I just come back go see one person when just die, a young lady when just give birth to a child when if baby never ever reach 1 month, she just died like that. Now only gonna know what kid that one now, and we see they try to find out what really happened. But I still believe that most of us would joke with our head too much, and more not have joke with our head. Try to once a while go hospital, go do test. You just go there, go check yourself. Tell them not be say you dey sick, oh, you don't need to dey sick. Just go there, go tell say, doctor, I want to do all the I want to do so investigation. They go tell you the kind of investigation when you go do. May they check you, may you know say yes, so these organs for my body they see they work well, oh. This part of my body see they work well, oh. To not be only to just eat all the food where they this world. No, please, I mean, more we try take care of ourselves, our mental health, our social health, and our physical health. Una well done. Una thank you so much.
Thank you very, very much. And finally, we know they do private chats on the internet. So in case you send us message privately in the inbox, no vex, we know they do private chats. We know they do private chats. So doctor, I send you message for your inbox. I beg, no vex. You go there on read, because now so we they do them now. You get why we don't do them like that. So speak with your doctor. If you want to follow us talk one-on-one privately, link there the page. You go follow process. We they try guide our actions on social media. All the goal now to ensure say you know take your health, take play. I always tell you, good life now waiting. Good life now sense. Take care of yourself. We will see you next week Sunday by the grace of God. Have a wonderful night. Bye-bye.
Bye-bye.